Hi there, my name is Kendall Lawrence, and this year in the 2022-2023 school year, I was a senior in the Health Practicum Program. So I wanted to come on here and talk about my experience in the Health Practicum Program and what it's taught me and basically what I've learned. So I've always known that I wanted to go into the health science field. I was a gymnast for many years. I've dealt with broken bones, and the first thing that triggered my interest for that is, radiology and orthopedics. So I've broken many bones, and I've been around people who have broken many bones, and so I've seen my x-rays. That they've always been really cool to me. So the first site that I decided to shadow was actually a neuroradiologist. The way that I got this site was actually through, I had one of my best friends who I did gymnastics with. Her dad is a neuroradiologist. Obviously I would have shadowed him, but they actually moved to Florida, so I was not able to. So I reached out to him, and he put me in touch with this neuroradiologist, and I shadowed him. He was actually an interventional radiologist, which means that he did basic procedures along with his, reading CT scans and MRIs and all that kind of stuff. So I did see a lot of that, but I also got to sit in on a couple procedures that he did, which were really cool. In these procedures, he injected contrast into the bloodstream, so he could see any clots and that kind of stuff. So that was a really, really interesting experience, but it actually turned me away from radiology because it's basically just sitting in a dark room and looking at a screen. And honestly, it was not the most interesting thing, but it was a really interesting opportunity to get to see that. So, yeah. The next place that I actually shadowed was Seton. And Seton is something that we got to do as a class that was presented to us as an opportunity for the class, and it was my favorite thing that we did this year for sure. During Seton, we were able to go to all the different floors, for example, cardio, endoscopy, the nursery, labor and delivery, all that kind of stuff. It was so interesting. I'd say that my favorite floor that I went to was the nursery, obviously. I got to see cute babies. I was really, I really loved that. And actually getting to be in the nursery, kind of sparked my interest in, maybe being some kind of, pediatric doctor or, yeah. And then I'd say my most interesting experience, at Seton was definitely, in endoscopy. When I went to endoscopy, they were doing a procedure where they brought in an interventional radiologist. There was a tumor in this man's liver or bile duct, and they weren't able to get it out with a normal procedure. It was too tight of a space, and so they brought in an interventional radiologist to use their special scopes and tools, and they removed part of the tumor, and I actually got to see that part of the tumor, which was so cool. It was insanely cool, because I got to see part of a tumor, and so I'd say that's probably my most interesting story and experience from going to the hospital. Definitely was an insane experience to see how it all, works, and all the time, and it's a lot of I didn't shadow very many doctors. I mostly shadowed like nurses and clinical assistants, and so it's a lot of patient care. Like you're like basically except for endoscopy, and the nursery, you're just working with patients and getting them what they need and giving them medication. So it was really, running around all over the place. It was really cool to see, their day-to-day life and what they do, because it really opened my eyes to like what it's like working in a hospital. And so the last place that I shadowed most recently was I shadowed the speech and language pathologists at Wooten Elementary and Murchison Middle School. So I got this shadowing opportunity through connections again. And it was really cool because I had seen the more, medical aspect of the health science field. And now I got to see the like more social and social aspect of the health science field. And I got to see I got to work with kids and diagnose them for autism, or, I mean, obviously I didn't diagnose them for autism, but I got to see the process that a speech and language pathologist would take to go and diagnose a kid for autism or social disorders or communication disorders. And it was really exciting and insane to see the process. They would ask them questions about like different metaphors and all of that kind of stuff. So the fact that I got to see both kind of sides of the health science field was really, really cool to me. Yeah, that was basically my health science practicum experience. Was an amazing experience that I would recommend to honestly everybody, whether you're wanting to go into the health practicum field or not, just because of like just the way that you get to interact with these like opportunities and like see all these different things. So yeah, I definitely recommend it to anybody. It was very interesting, and I'm so glad that I got to participate in it this year. Bye.